Welcome to Meet Your Future, and my name's Bronwyn and I'm part of the Bridge GM team here at Greater Manchester Combined Authority. So we launched Meet Your Future all the way back in 2019 so that young people just like you can meet and connect with employers and really experience different workplaces as well and find out about the different roles and opportunities here in Greater Manchester. Over the past 12 months, we've been speaking with young people from all 10 boroughs of Greater Manchester to find out how you are really feeling and how you want to be supported now and within the future. And we have developed a suite of information, resources and services that are really there to help you to find different opportunities and have some of that advice, guidance and support. And you can find these on GMAX, the Greater Manchester Apprenticeship and Career Service, which many of you will already be familiar with. And as part of this, we have also adapted Meet Your Future to kind of reflect what you've been telling us. And you can now, throughout this academic year, join sessions and chat with Greater Manchester or national employers about growth sectors, different pathways, and the array of career opportunities here in Greater Manchester. In this session, you'll be hearing from the NHS Careers Hub and from different people who work within the NHS, all about roles in the allied health professions. And hopefully this will, the session today will inspire you, you'll learn a lot and really show you why you should be hopeful and optimistic about the future here in GM. So throughout the session today, there'll be lots of chances to ask questions to everyone who's presenting, and so please make use of the Q&A box, any question at all, and we'll come along and answer all of those. So I would now like to introduce my colleague Chloe, who works for the NHS Careers Hub, and will take you through the session today.
Hello everyone, I hope we're doing well. Welcome to this session on allied health professionals, and yeah, I hope you're going to really enjoy today. So the allied health professions are a really exciting and interesting staff group that I feel like everyone should know about. They work in a range of different roles and have lots of different responsibilities and things that they are involved in. Now, hopefully some of you have done a little bit of research into allied health professions, so I won't say too much now because I'd like to hear what you have discovered and what you have been finding out within your research. But today we're going to be talking a little bit about these, and then we're going to be hearing from some people who actually work within these roles within the NHS, so you can see a little bit more about how you might work within these roles and what you might do day to day if you were working for the NHS as an allied health professional. So the allied health professions are one part of the NHS, but the NHS obviously is a massive system, and what we try to do within our sessions in the GM Careers Hub is to ensure that you understand and know about all the different possibilities you have within the NHS. The NHS is massive. And I think we're often quite guilty when we think of the NHS and jobs in the NHS. We think of doctors and nurses, but we don't always think about the vast range of other roles that are available. And that's what we're trying to do here with the Meet Your Future programme and with our own sessions to ensure that everybody knows about what is out there and what is available. So I hope today you'll learn about one small aspect of a very wide system, a big system of the NHS. So as mentioned today, it's all about allied health professionals, and I'm hoping that you'll learn something new today. To begin with though, I'd like to think of the NHS a little bit more as a whole and to see if you guys know about how many jobs are actually within the NHS. So my first question for you all, and if you can pop your answers in the chat or the Q&A function, is do you know how many roles there actually are within the NHS? Do you know how many jobs there are out there for you within the NHS, different types of jobs? I'm going to pop your answers in the Q&A or the chat, and then we can see what you come out with. Okay, so we've got 245, about 300, 358, great answer there, about 20, 355, great answers there, well done. Fantastic there, everyone. So within the NHS, there are actually just over 350 jobs. So that's how many we have within the NHS. And so for those of you, I can see some people said 355, 358, around 300. Well done. Those are correct answers. That's fantastic. So yeah, so there is over 350 jobs in the NHS. And like I said, today we're going to be looking at one part of that. And what I really want you guys to remember kind of coming from this session is how many different jobs there are within the NHS and social care as well. So we have different jobs in the allied health that we're going to talk about today. We also have jobs within healthcare science, and those are the people who do all the research behind the scenes to ensure that we are doing research on treatments, that we are understanding and diagnosing people, and that we are able to investigate different kind of diseases, different kinds of treatments. So that's what the healthcare scientists do. We have people within nursing and midwifery and lots of different types of nursing and midwifery roles. So, for example, adult nursing, midwifery assistant, theatre nurses, paramedic nurses, so lots of different people in that area. We also have people within health and social care, so all of the people who work within nursing, allied health, and in other areas also work within social care settings as well. And by that I mean care homes and supported living centres for people with additional needs or the elderly. We also have people working in corporate areas, and sometimes you may start as an allied health or a nurse and then go into a corporate role. So those are people who work in human resources, in finance, in reception, administration, in recruitment. So they're really important. And then we also have people in maintenance and support as well, or estates and facilities, people in jobs like engineering, caretaking, painting, decorating, all those different kinds of roles. So the NHS is huge, it's massive, and there's so many different opportunities that you can do within the NHS. It's a really kind of vast range of opportunities. I feel like any job that you can think of, you can do within the NHS pretty much. But today, as mentioned, we are going to focus more on the allied health professions as one of the kind of larger groups of staff within the NHS. And again, I think a really exciting area for you guys to investigate. So some nice little illustration there of some of the different allied health roles. And so hopefully you guys maybe before this had a chance to have a little think about what is an AHP and what do we mean by that. So I've got a few questions here that I'm hoping you can help me answer. So the first one, which I hope will be an easy one, is what does AHP stand for? Quite often in the NHS we like to use acronyms. So we like to say things like, you know, AHP or NWAS for North West Ambulance Service. We've got quite a few acronyms. So becoming comfortable with those is a great kind of skill to have if you want to come work within the NHS or social care. So the first thing is, what does AHP stand for? So you can pop your answers in the chat and hopefully you guys are able to decode that. Fantastic. Okay, so I can see some answers coming through now, which is great. And I'm hoping that's quite an easy start, because it is actually, if you look kind of above on your screen, it is the title of the session. So I'm hoping that's quite an easy start. So yeah, AHP stands for Allied Health Professional. Or allied health professions, and they're used kind of interchangeably, professional or professions. Yeah, like I said, within the NHS we love acronyms, so it's great for you to start feeling comfortable with the use of those terms. But yeah, AHP stands for Allied Health Professional. So my next question then, and if you don't know, if you don't know it, you can always guess. Does anyone know? Oh. These are coming through a different, there we go. Sorry, they came through a little different order, but the second question is, how many different AHP roles are there? Can anyone tell me how many different types of AHP job is there within the NHS? Or in social care actually as well? Like I said, if you're unsure, feel free to kind of guess. Okay, so we've got some guesses here. Oh, a wide range of answers. Exciting. Okay, so some people said 14, some people said 50, 100, 14, 53, 150. Great guesses here. Thank you all for putting answers in. It's fantastic to hear what you guys are thinking. 20, 32. Okay, so the official line here is that there is 15 different allied health professions. And so the allied health professions is quite a big group of staff. And I'll talk through some of these now. So listed as an allied health professional, we have art therapy, diagnostic radiography. So that is when you go and say if you've broken your arm, the person doing your x-ray, diagnosing the pain or the or making a diagnosis. We have dietitians, drama therapists, music therapists, occupational therapists, operating department practitioners, orthopodists, osteopaths, paramedics, physiotherapists, podiatrists, prosthetics or orthotics, speech and language therapy, and therapeutic radiographer. So those are the range of roles that are in allied health professions. And I'm sure there's some there that you're thinking, yeah, I've heard of that one before. And I'm sure there's others where you're like, I have no idea what that is. There's some really interesting roles, but basically allied health professionals all either treat a part of the body. So for example, podiatrists treat your feet, or they use a certain type of maybe treatment or therapy to support you within your recovery. So for example, a therapeutic radiographer uses radiotherapy to treat cancers. A dietitian may look at your diet and help you kind of treat or diagnose different issues that are happening with your diet. So they're all focusing on a specific kind of treatment or a specific kind of part of the body. I mean, that's a very overarching description, but that's kind of where we're at there. And the final question I have here is how many AHPs work for the NHS? Now, I've listed quite a few different jobs there, and the AHPs are actually the third largest professional group within the NHS. So they are a large professional group within the NHS. There's a lot of AHPs within the NHS, and I'm thinking maybe before today, some of you didn't know what an AHP was or an allied health professional was, but I'm sure at some point you will have come into contact with an allied health professional. I'm sure there's a lot of you in the room who've had an x-ray, who maybe have seen a paramedic, who have maybe seen a dietitian. So you will have come into contact with these people and you will understand what these people do. And they're a massive staff group, but we often don't know what the term allied health professional is. And I didn't before I started working for the NHS, but it's such a huge staff group and it's such an important area for you guys to know about. If anyone in here is wanting to go into healthcare and wants to explore healthcare as an option, the allied health professionals are a really great group for you to investigate, for you to research, and for you to start kind of thinking about and understanding exactly what they do, because they have a lot of the time have real kind of patient contact. A lot of the time they're treating different conditions. Sometimes they diagnose different conditions. They can prescribe medications sometimes. So if anyone wants that kind of face-to-face patient contact, the allied health professionals are a really great diverse group that do meet a lot of different interests. For example, art therapists, theatre, music therapists. If you're into your arts and you're creative, they're a great area to go into. If you're interested in food, for example, and science and nutrition, dietitians are a great area to go into. So they meet a lot of different interests, and they can they're interesting to a lot of different people, basically. So they're a really great area for you to investigate and for you to research. Now I'm going to stop talking because I'm hoping that that's given you a bit of an overview as to what an AHP is and kind of how they sort of fit within the NHS and within our system. But what I really want you guys to hear from today is people who are actually doing these jobs, who work with the NHS day to day, so you can really understand what they do in their job, how they maybe got into this job, and who might these kind of jobs appeal to. So I'm now going to pass this over to to our ambassadors, who are going to tell us a little bit more about what they do in their job, and how they got into it. So if we can, I'll stop sharing my screen because we don't need to see that. And I will pass over firstly to Julian, if you're ready to give us a bit of an intro about yourself and what you do.
Thanks, Chloe. Hi guys, my name's Julian. I'm an allied health professional, as you've heard, and my acronym is an FCP. Now that stands for First Contact Practitioner. So my background is ultimately physiotherapy. That's what I started out as, but over the years I've kind of developed in the role that I've been in to be the first contact practitioner, working now in GP practices, and that's around the Oldham area. So my role at present is to be the first person a patient would see if they were injured or if they were concerned about any pains they were having with any joints, any bones, any muscles of the body. And that's anyone over the age of 16 in my current role. Traditionally, they would have seen a GP, and a GP is known as a general practitioner, so they'll know a lot of things about a lot of things, whereas my role is more specific in regards to something we call MSK, another acronym, and that stands for the musculoskeletal system. So as I said, anyone that had any issues with bones, joints or muscles, they would come and see me first. And traditionally we'd get half an hour in the GP practice with that patient, where we'd first and foremost it's listening to what the patient's telling you about themselves, looking at their kind of background medical history and seeing if we can link those 2 or 3 things together to see what's happening with the patient there and then on the day. In this role we can also prescribe, we can inject patients that are in pain as well, and the whole point of it is to reduce some of the pressure on the GPs, but also ensure the patient sees the right person kind of first time. So let's say you've strained your ankle and you think it's broken, and your parents phone the GP and said, "Oh, I think my son or daughter's broken their ankle." You would then come and see me. I'd do a couple of assessments and we'd see how stable the ankle was. And then if needs be, we could refer you on for an X-ray, as Chloe mentioned before, where you'd have a diagnostic radiographer and we could then confirm if it was broken or not. And then you would go to a traditional physiotherapist who would then do your longer term rehab. My role at present doesn't do the longer term rehab. It's kind of getting the first initial assessment and then moving you on to the correct individual. Now Chloe was asking, how did I get into this role? And first and foremost, in whatever you might want to do, always have an open mind about it. And however you're working, work to the best of your abilities, and even with adversities, use them to your benefit, because you'll learn new skills and better skills in those adversities. So kind of how you guys are now, I had to do work experience, and I did mine in a veterinary practice because I thought I wanted to be a vet. However, I was more interested in the rehab of animals after they've had surgery or after they've been treated by the vet. And I kept on asking, what happens next? What happens next? Now what happens? And the vet kind of said to me, I think you're more interested in rehab rather than actually being a vet. And that's how I ended up kind of being a physio. So the traditional physio role I've done now for over, I think it's about 17 or 18 years. And then over the last 12 years or so, that's where I specialised into the MSK role. And the skills needed for that really, and in any healthcare and in any job, is communication and it's listening. When you listen to your patient, or if you listen to your client, they will give you 70 to 80% of the information you need, and then you'll use your specialist skills to then hone them into where the patient needs to go next.
Good morning, everybody. Nice to be here. My name is Wesley Proverbs, and I'm a paramedic with the Northwest Ambulance Service. I've been doing the role for the last 12 years now, 12-year anniversary this week. So my role is to respond on emergency situations to people who are extremely poorly. We drive under lights and sirens, as you may be aware, and once we get there and arrive at the scene, we'll assess our patients to assess the level of illness, and then we have to make advanced decisions to decide whether we're taking them to hospital or whether we can refer them to local communities. So we'll use physiotherapists, GPs, pharmacists, nurses to work as a team, as discussed previously, to decide whether they can stay at home or whether they need to be taken into hospital for further treatment. Within the ambulance service, there's various roles that you can then progress onto. So you will join as a technician or a paramedic like myself. I joined as a technician 12 years ago and then progressed in my career, went back to university to get my degree to be a paramedic. But you can move on to senior paramedic team leaders, advanced paramedics. You can work on helicopters, and you can work as part of the hazardous area response team, which is quite interesting. So they'll respond to big events, major RTCs, road traffic collisions, another acronym there, major fires and major incidents. So there's a wealth of options once you join the ambulance service. I've really enjoyed my time, and it's a great place to be.
Great, thank you, Wesley. I don't know if you can just briefly, because I never knew much about the role of a technician, and obviously they're quite important in the ambulance service. So I wonder if you could just briefly, I know you said you were a technician first and you were a paramedic, if you could just briefly explain the differences. And I'm sure everyone in the room would probably have maybe seen a technician before and not realised that they weren't a paramedic.
Yeah, so in the ambulance service, we like to use these epaulets that highlight our positions. So mine says paramedic. You'll come across people that have EMT1 or maybe EMT2, and they're technicians. So as paramedics, we have more advanced skills. We're able to administer certain medicines, painkillers. Technicians can administer some medicines, but their main role is to support the paramedic. We would be useless without them. They're really important and help us to deal with all emergencies. So they are attending the same jobs that we attend. They're doing the same work that we're doing, but they're just not able to give certain medicines. So they'll drive under lights and sirens as well. And they have some advanced skills like resuscitation. So they know how to perform effective CPR, and it's a really, really important role. It's a great way to come into the service and then develop your career.
That's great, thank you, Wesley. And for those of you who may be interested in doing an apprenticeship, there is some out there for technicians as well. So that's another way, like you say, into paramedics. But yeah, that's really interesting. And again, if anyone has any questions, pop them in the chat, and then we'll hear from Naheed first, and then we will answer those questions for you. So Naheed, I don't know if you want to give us a little bit of an overview of your role and how you got into that.
Hi, morning all. So my name's Naheed. I'm going to start from the beginning of my career. So growing up, I thought I wanted to be a teacher, actually, and I used to teach my teddy bears, and everyone thought I was going to be a teacher. And then I sort of went to school and sort of toyed with a couple of professions, thought I'd be a dentist, and then I settled on being a policewoman. So I went to Manchester University, I did a degree in social policy, and after a couple of months it just wasn't for me, so I dropped out, and I was sort of working in Tesco's in Manchester town centre and sort of thinking, what do I want to do? And it wasn't clear for me, and like my sisters were very sure they wanted to be X, Y and Z, I was really unsure, and I'm not too sure what made me decide to be a physio, if I was really honest. I'd never seen a physio, I'd never had experience of receiving physio, didn't know a physio, but it sort of just popped into my mind. So I then did, I was on my gap year now because I've dropped out of uni, so then I did some work experience. I worked at Stepping Hill in the admin section, as Julian described, in the sort of outpatient setting in musculoskeletal. I did some work in a local charity with disabled children, working with physios there, and in the gym as well. So I worked Fitness First, it was. So I just sort of got a feel of different types of physio and thought, oh, okay. So applied, got through, and then my career's done weird and wonderful things. So I'm from Manchester, so I was very keen to come back to Manchester after work. So I studied in Nottingham. So I applied for a job in Manchester and got the job, and I did my core rotations. We describe core rotations because when you start your physio career within the NHS, you move around different specialities and you sort of rotate, and that gives you a real feel, because a lot of people come out of uni and think, oh my god, I don't want to do that type of physio, or I do, and I came out of uni thinking I do not want to be an MSK physio, which is what Julian's doing, and that was just because I had an experience with a on placement where it wasn't all that positive. And then actually when I started my job, that was my first role, and then I absolutely loved it. So I went on to think, right, I'm going to be an MSK physio. People come into physio thinking they're going to work with football teams, rugby, you know, it's so vast, but you don't really know what you know because you haven't done all the areas. So that's quite useful to rotate round and work in those specialities. And then you sort of get to a point in your career where you want to sort of move into a niche area, you want to specialise. So at this point, I was sort of 2-3 years in. I decided I wanted to be an MSK physio, and I moved abroad, which is obviously moving out of the NHS, but I moved to Singapore as a physio, and I think that's what's amazing about being in these roles. You can be a physio in Dubai, you can be a physio in Australia, depending on where you wish to live. You might have to do additional education courses, etc., to reach that registration within that country. But for Singapore, I didn't have to do anything extra, so I just applied for a visa and I moved to Singapore and I worked there as a physio, which I thought was fantastic. So it's the opportunity to do things outside the UK. And then I came back and then I worked in various areas, and then I moved into amputee rehabs. Well, actually, I worked in intensive care for 2 years. So I'd gone from being MSK physio, dealing with neck, back pain, sports injuries, adults, children's, to then coming back to the UK and working in intensive care. So these are people that are really poorly, unfortunately. A lot of stuff that Wesley touched upon, road traffic accidents, major heart attacks, coming in and they might be tubed on ventilators, you know, breathing machines. So that's a very different type of physio, very, very interesting. And then I went and worked with amputees for a while, which I absolutely loved. And Chloe, you mentioned prosthetics and orthotists. So anyone that loses a limb would obviously benefit from a prosthetic limb, which is essentially a fake limb. So it was basically working with these patients to learn them to teach them how to walk again, which was fantastic, really enjoyable. And then I ended up in my current role, which is major trauma. So again, Wesley touched upon this. So anyone that's had road traffic accident, unfortunately, violent crime, suicide attempts, falls of a certain age and cause lots of major injuries to themselves, end up on my ward, and we're basically dealing in the rehab with these patients. So it's really interesting, very diverse group of patients, from the young to the old. And then again, Chloe, you mentioned people moving into sort of different roles. So I'm currently on a secondment. So I work for major trauma, and 50% of my time I'm working on the wards with these patients, being a physio, but I've sort of I'm now moved into the corporate side for 50% of my role, and I'm actually working still in MFT, still in the organisation that I'm from, but looking at growing the AHP workforce. So looking at all the 14 professions that we talked about and looking at how we can support the growth of that within the organisation. So people coming in, so people like yourself that might be thinking, what's a dietitian, what's a dietitian, what's a speech language therapist, encouraging them to join, but then also the staff that are in the hospital, how do we keep them? Because it's important, and to recognise that working in the NHS it's hard, it's, you know, it's it can be quite demanding, but it's a really good role, it's really rewarding. I think the word resilience comes to my mind when I think about NHS staff. And it's a job that's it's needed, you know, during COVID, during Christmas, during, you know, Easter holidays, you know, the NHS still runs. So it's a great place to work. It's a great workforce, but it's basically recognising that there are things that we need to do to ensure that people work for the NHS and stay in the NHS. So that's what I'm doing as well. So it's just looking at different opportunities, and I think the skills that you acquire as a physio, and I speak, I'm sure it's the same for the other HP professions. I think they're quite diverse. It's problem solving, it's seeing the bigger picture, it's understanding the process. So I feel like those skills are transferable. So even in this corporate role that I'm doing, which is completely different, and I've sort of described it to one of my friends the other day, because I haven't looked at Excel sheets or graphs or written reports since I left university, because I've been on the wards face to face, treating patients, writing notes, and then that's it. And I feel like I'm, you know, on Excel going, how do I do a graph? How do I do this and stuff? So, you know, it's pulling up things that probably somewhere in the back of my mind, but it's interesting, and it's, you know, but the majority of the skills that I've acquired over the last 12 years in my career are transferable. And I think the great thing about being an HP is you can always learn. So it's not a static role. You're not sort of stuck and you're not sort of at one position. There's opportunities to grow within your profession. You can diversify yourself. There's always things to do. There's always courses. So you feel that it's constantly evolving as you get what you put in, essentially. So that's all from me. Thank you, guys.
That's great, thank you. And I think it's really interesting to hear from you about the range of different roles within physio, because like you kind of alluded to there, when we think of physio, I often think of, the person at the side of the football pitch dealing with sports injuries, and it's really interesting to hear about how you would work in other areas as a physio, because I think that kind of isn't always what comes to mind, but it is, it does, you do work in those different areas, and so yeah, it's really interesting to hear. And I just wondered if you could also very briefly, I know with Wesley we spoke a little bit about a technician, which is a role you can go into after college. With the AHP roles, they often require degrees, and I wondered if you could maybe briefly describe the role of an assistant in, I don't know if you work much with physiotherapist assistants, but that's just a different kind of opportunity for people who maybe don't want to go down the HE route. I just wonder if you could briefly describe what that is.
Sure, and yeah, you're right. To be a physio, you BAc honours degree, but there are opportunities now where people are looking at apprenticeships as well, which is another way in. But absolutely, so rehab assistants work with physios, occupational therapists, and they sometimes classed as rehab assistants. You can be an assistant in different areas of AHP world, but the physio assistants I work with would assist us with the patients that we're seeing. So if you think about the major trauma ward that I work on, we might have someone with about 8 broken bones, and they might have told us that the right arm and the left leg, you're not to put any weight on those. So this person's maybe quite a heavy sort of built person. So to get that person out of bed, it's not going to be an easy task. So it might take a couple of us. So in that instance, you might, as a qualified therapist, decide that you want a sort of team of people to come with you, and that rehab assistant will join you. So they are helping you and supporting you with the rehab of the patients. They don't make the clinical decisions, so they're not the ones that are going to say this is what we're going to do, but once you've come up with a plan, they might continue to carry out the treatment. For example, the man I've just described with a broken arm, he might benefit from range of motion exercises. So you might say to the rehab assistant, can you go twice a week to just make sure this man is doing his exercises? They might help the occupational therapist with washing and dressing assessments. There might be that second person when you go on the home visits and access visits. So a lot of the stuff that we might do continues into the community. So you might have a patient that you're trying to get home and you don't understand the home environment, so you might need to go and do a visit to that person's property or take them home and make sure it works so that they're safe. So that rehab assistant is supporting you in those joint sessions, and obviously the admin side of things, helping with referrals and paperwork. So when I touched on apprenticeships, this is something that's coming up, so hopefully by the time anyone here is listening, this is a way in. So you might choose to be an assistant where you'll be working in a team with physios, OTs and whichever HP profession that you're working with, and then you basically sign up to apprenticeship, which is a 2-year course essentially, where you can then work your way up within the organisation and actually sort of learn as in a clinical environment rather than being in university, which often might not suit everyone's needs. So that's another way in. And I suppose with the assistants that I've worked in, a lot of the younger ones that have come through have actually come in as assistant to sort of work out if they want to do physio or be an occupational therapist, and it's a really good way to get the experience. I think the hardest thing about starting your career, and I don't know if it's the same for Julian and Wesley, for me, was just having confidence speaking to patients or being familiar with the hospital environment, the smells, and once you're able to do that, build that rapport, the learning kind of happens afterwards. So I think by being that assistant first, you've got a real taste and flavour of what to come and that experience as well. So yeah,
that's great, thank you. I just think it's good sometimes to think about alternative routes into different jobs. But yeah, so we now have some time for questions if anyone wants to pop their questions in the Q&A. They could be for any of our ambassadors or about working in the NHS more generally. If anyone's got any questions about what it's like to work with patients or what it's like to work in A&E or in a GP or in an ambulance service. So yeah, please pop any questions that you have into the Q&A or the chat, and we will answer those for you. Okay, so I think we've got one question here already, which is for Wesley, and it's asking, what did you do as a technician? I suppose you've kind of briefly explained a little bit more about what you did as a technician before being a paramedic, but I suppose what might be quite interesting, Wesley, to hear a bit about is, I suppose, what it's like. What's your a shift like? What do you actually do, if that makes sense? Do you have to work shifts? How does it all kind of come together? I don't know if that makes sense.
Yeah, no, I'll start by explaining how I started as a technician. So I joined the service directly from, I was working in B&Q before I joined the ambulance service. So I did a 9-week training program where I was taught the basics around body systems, the workings of the ambulance service, and then I trained to become an advanced driver, to drive under blue lights. That was my main role then, was to drive under blue lights and support the paramedic in their role. Yes, there is a lot of shift work, so it's nights, days and weekends. Initially, it took some time getting used to. I was a big sports fan, liked playing football, and that had to kind of end due to the shift work. But I don't mind shift work now. I quite enjoy it. It's nice to be off during the week when everybody else is at work. And night shifts can be quite interesting because sometimes the jobs are a bit different to what you get during the day. So you might see more trauma during a night shift than you would during the day. So that's one element that I do enjoy. But no, that's the main role of the technician, is to support the paramedic where they can. I hope that's answered your question.
Yeah, that's fantastic. Thank you. And someone's popped in here. How many years does it take to qualify as a paramedic? I suppose there's two different routes, isn't there, into paramedics? You could go straight into university and do that as a degree, can't you, for 3 years? Or like you say, you can start as a technician and then go into paramedics. So how long kind of did it take you to qualify as a paramedic? So
I did the technician course, like I explained. I worked as a technician for 7 years, and then I went on to do my paramedic course. Fortunately for me, NWAS paid for my degree. Back then it was a diploma. I then had to do a top up to do the degree. Now, as a direct student, it's a 3-year degree. But you can join, as you say, as an apprentice, and then after 2 years of doing your AAP, you can then go on to do the paramedic conversion to become a paramedic.
That's great, thank you. And I've got a question here. I think, Julian, if you want to answer this one, which is, what is the hardest part of the day working in the NHS? I suppose, is there anything you find particularly challenging?
For me, it's for your more complex patients. So as I said, being a first contact practitioner, like with Nahida and with Wesley, anything can come through the door. So because you've got a strict 30-minute appointment slot, if you've got a patient that needs to be urgently referred to A&E or needs a paramedic, that has a knock-on effect on the rest of your clinic, so you can run behind. So some patients can take 20 minutes, 15 minutes, even though you've got 30 minutes, whereas others might be an hour turnaround time where you've got to work them up to be onward referred, speak with the GP, and the more of a complex patient. So the hardest time of the day, I'd probably say from my roles, more going into the afternoon. So in the morning, you're nice and fresh, your brain's nice and fresh, you've had your breakfast, and then bit by bit as the day goes on, you can become more and more tired and more fatigued. So in my previous role, I was working more remotely, and there I'd have up to 23 patients a day. So I knew at 5, and I was doing long days, let's say 8 till 8. So I knew by patient 15, around about 4:30, 5 o'clock, you could feel yourself wilting a little bit. So more into the afternoon tends to be the hardest part of the day. But again, it's all individual. If you're more of an afternoon or evening person than a morning person, you might wake up a bit more and have more energy into the afternoon. Whereas if you're more of a morning person, you've got more energy and more vigor and more energy there. So yeah, it's down to the individual.
Yeah, and I suppose that as well in terms of like being tired and doing different shift patterns. And I know kind of Wesley mentioned there about having to work different shifts and stuff. I suppose thinking about, you guys at home, thinking about what you want to do in the future, you kind of, I suppose, you have to think about those kind of things, like what kind of person am I? Do I think I could work shift patterns? Do I think I might be better working a standard day? Can I cope with the busyness of the NHS? Because it is full on, isn't it?
Yeah, and the thing is with that as well, that's never set in stone. When I was you guys' age, when I was 17, 18, I could stay happily up till 2, 3 o'clock in the morning and have full energy. But now I'm a bit older, you might be able to see the grey hairs. Come 10 o'clock, I'm like, you know what, I'm ready for my bed. So it's always asking yourself that question at different stages of your life. What do you want? What do you enjoy? Who are you as a person? That's the main question. And then continue to ask yourself that question every so often, because it will change as your hormones change, and as you get older, it will change as well. So my advice would be definitely be true to yourself, because when you are, you will enjoy your job much more, because you're giving up yourself and it's you. And then the last thing is conserve your energies. So remember, what I always tell my students and people that I work with, if you look after the number one first of all, and you've got your energy, you're healthy, you're fit, you're active, and that type of thing, you can help everybody else because you've got more to give. Whereas if you're depleted and if your mental health isn't where it's meant to be, and if you're tired all the time, you can't give as much as you would normally. So make sure you look after yourselves as well.
Yeah. Great, thank you, Julian. There's a couple of questions come through about qualifications. Now, for most of these jobs, you do need to go to university and do a degree. And like we said, there's other different routes in. But I think the main thing in terms of looking at qualifications, what you need to do them, it's looking at the universities. So I would recommend, even if you're not at the stage where you're wanting to apply for university yet, looking on the UCAS website and seeing what qualifications you need to do certain degrees. They do differ between universities. So, for example, some for physiotherapy may ask for a science, some may ask for biology specifically, some may also accept kind of PE, for example. So they all ask for kind of different things sometimes. So what I recommend doing is, if you know that you want to be an art therapist or a physiotherapist, I would recommend going onto the UCAS website, finding a range of degrees that do that subject, seeing what qualifications they ask for, and that might then help you sort of see what the general consensus is, and allow you to sort of pick out which ones you want to do. So yeah. I've got a question now for Nahid about, so someone's asked, how do you cope with upsetting situations? Now, Nahid, you worked in A&E for a little bit, so I wondered if you can kind of answer that.
That's a good question. I still remember the first patient of mine that passed away, and I'm sorry to be so morbid. And I was a student at the time, and I still remember him, and I remember everything about him and his wife. And everyone's different, is what I'd say. But it does affect you, and you know, as a human, and I think as a person that works in an environment where you're caring, and you know, you see things that are upsetting, it does affect you. But I think what happens is you learn to sort of grow sort of a tougher skin, and I suppose it's recognizing that what you're doing is so helpful and so rewarding, and you know, getting people home after, you know, horrible injuries or getting them walking again, it's so rewarding that sort of balances it out for me. But there are times when I come home and have a bit of a cry, or you know, but I think what Julian said, it's about looking after yourself. So it's recognizing what works for you. Some people have debrief sessions, they might talk to colleagues, they might talk to, there's an employment wellbeing service in the NHS as well, so that supports, you know, staff. I like to exercise a lot, so I go for a run, I go for a swim, and that's my way of doing it. Other people might, you know, jot things down, or so yeah, it is part of being in the NHS. You might see things that, you know, that do upset you, and it's like I say, everyone's different, so I can't say what works for me won't work for you. You know, it is just bearing that in mind, but it's recognizing if you are affected by something, it's how you deal with that. So it's really important. I've worked in teams that I feel very supported, so if I've seen something that's upset me, I've come down to the office and said, do you know what, I don't feel I can go on the ward this afternoon, or I've had a nice cup of tea and spoken to someone just to debrief. And so yeah, I can't promise you it's all singing and dancing, and you know, but for me, the greater good outweighs sort of the bad times and the sad times, and so that's what works for me.
Yeah, No, that's great, thank you. And we've had a really great question here, which I think to finish on, I'd like to kind of ask sort of each of you, which is what is the best day you've had working in the NHS? I suppose the best thing about working in the NHS. So I don't know if maybe Wesley, if I want to go to you first about kind of, you know, the best thing you think. I can't get my words out. What do you like the most about your job, or what's the best thing about working in the NHS?
For me, the best thing about working in NHS is being able to help people in their hour of need, being able to support them when they need you most, and having the opportunity to use your skills that you've trained over many years and then apply it when necessary. One that stands out for me is a patient who had been having a heart attack and then went into cardiac arrest. We managed to resuscitate them, treat them, and then transport them to a specialist heart unit where they got the treatment they needed. So it was a combination of teamwork between the ambulance service, the local emergency department, and then the specialist heart unit to make sure the patient got all of the treatment they required. And then there was a positive outcome because they returned home and was able to get on with their normal life. So that was one of my greatest days in the NHS.
Yeah, that's fantastic. Thank you. I don't know if Julian, if you've got anything you'd like to share.
Yeah, best thing for actually working in the NHS is being able to kind of use your own personality and skills, as Wesley said, to kind of facilitate patients getting better ultimately, and kind of giving up yourself for the patient. And from a personal point of view, my best day in the NHS was when a combination of my GP, a cardiologist, and the Manchester Heart Foundation found out randomly that I had a complete heart block. I had it for years, knew nothing about it, healthy and fit, blood pressure fine, generally fine. But then through the work of the GP saying go for an ECG, and seeing that my heart wasn't beating as it should. And this is the beauty of the NHS, because ultimately they said if we didn't know anything about it, you could have just passed away at some point and no one would have known. But because of the skills of the sonographers, the technicians, the cardiologists, the GP, all work together literally to preserve life. So yeah, over the course of 6 weeks, I ended up with a pacemaker that I would never thought I would have had at my age. And that was my best experience and best time in the NHS for professionals doing the job, actually caring and preserving life. So it's a great place to work. So I fully endorse it.
That's so interesting, I suppose, as well, hearing about, I suppose, you as a patient as well.
Yeah.
And I think, Julian, you've described, and I think everyone here has described really well about how people all work together in the NHS. And I think, you know, I think people often maybe think that, like, your GP, for example, will work kind of on their own or in silo, but actually you all work together, which is really interesting to hear and to sort of see how you all kind of work as a collective. But yeah, that's really great. So I suppose to finish then, I don't want to leave Nahida out. And if you want, sorry, I can't talk again. If you want to share with us your kind of favourite thing about working in the NHS, and then we'll kind of finish there.
Yeah, Julian, that was a fantastic story. So I feel like I can't top that. But it's going to sound really corny, but I still get very emotional when you have someone who's really badly injured, you get them home and you get them back with their family and you see their kids run up to them or their dog, like, celebrate the fact that this person's home. Or you get that person walking again, after having an amputation, they've been sat in a wheelchair for 8 weeks waiting for this prosthetic leg. And I don't get bored. I don't get bored of that feeling of, oh my God, you're standing and you're walking, and I've played a role in that. So that's really, really amazing, to do that. But I'd also say, from a personal point of view, with COVID, it was just seeing how resilient everyone in the NHS was. And I got redeployed. I got redeployed to the Nightingale, and it was literally, I got picked up and dropped in a train station, an old train station, and said, make a hospital of this. And I've just never seen people work together so well. You touched upon this, Chloe, and we had people from all walks of life that have never worked with patients before. We had airline stewardesses coming onto the wards to help, and it was like pulling together like I've never seen it before. There was army officers at the Nightingale, and I looked around and thought, we're in the middle of a pandemic. Everyone's really anxious. PPE at that point, the gloves and aprons was changing back and forth, but we came in every day, we treated patients, you know, we were doing things that were classed as aerosol generating, which means potentially at risk of developing COVID, but people worked and did it and got on with it and wore horrible masks and worked awful shifts. And so I think it's, you know, at times like that, I looked around and thought, I absolutely have mutual respect for every single person that, you know, works for the NHS right now, because it was a very scary time when a lot of people were in furlough and a lot of people were off sunbathing. We were in working. So, you know, it was lovely when the people were clapping on a Thursday night. It was nice that we got into the shops and avoided the queues, but it was just recognising, and I said earlier, just how resilient the NHS is. And, you know, touch wood, if there was, you know, a pandemic of some description, or if there was the Manchester bombing, for example, we saw a lot of the patients that came through there as well. It's recognising that at times of adversity, we're there, and I don't just mean allied health care professionals, I mean nurses, doctors, admin staff, cleaners, all of us, because it wouldn't run without everyone doing their role. And it's, you know, it's working together. It's absolutely everyone all the way up and everyone all the way down. So yeah, I would certainly recommend it as a place to work.
That's amazing, thank you. And that's such a great place to finish. Thank you so much. So yeah, I hope today has really opened your eye about the allied health professions, or some of them. And just thank you all so much to our ambassadors for joining us today, and for you guys for having such amazing questions. You know, it's been great to hear from these guys and their stories. And as I said, if you want to learn more about the allied health professions or anything else in the NHS, I'd really recommend going onto the NHS Careers website and looking at the Explore Roles site. There's lots of information on there about all of these. And if you're looking and thinking about going to university, again, look on the UCAS website for some, you know, for what your options are. But there is lots of information out there for you to do a bit of research. And as we've kind of alluded to today, there are some different options in terms of apprenticeships and things out there as well, which we've spoken about and will speak about in lots of different sessions with Meet Your Future. So please do join us again for another session to hear a little bit more about what is out there. But yeah, thank you all so much for joining. Thank you.
Fab. Thank you, Chloe, and thank you to our incredible ambassadors as well. I really hope you inspired throughout that session. I certainly learned absolutely loads about allied health professionals and working in the NHS as well. So you can keep up to date with everything Meet Your Future and GMAX on that link there to GMAX. And I'm also going to pop to the chat a feedback form for you to complete as well, to tell us if you enjoyed today, anything you'd like to change as well, and what you'd really like to see through Meet Your Future too. But apart from that, I hope you all have a lovely rest of your Thursday, and thank you for joining us today.